Hello, my name is Jessica Crunkleton. I'm a licensed marriage and family therapist, licensed clinical professional counselor, certified alcohol and drug abuse counselor, approved EMDR consultant, sand trade therapist, private practice owner, and a bunch of other stuff. I wanted to come on real quick and just talk a little bit about some things I think will be helpful for individuals to know before they take their EMDR basic training. I've worked with now, I would say, provided EMDR consultation for over 700 clinicians across the United States and Canada. I've done almost 40 EMDR basic trainings online, in person, 2 day, 5 day, you name it, I've done it. And I really enjoy this work. I'm also an EMDR trainer in training, so I'm coming from experience here. Um, I want to talk a little bit about some of the barriers that people are facing. One of the big ones, I think, is people coming in with just a misunderstanding of EMDR. They don't have a clear understanding. Again, the training is going to help you have a better understanding. But one of the big things that you can do, number one, is to do your research. Read the book, Getting Past Your Past by Dr. Francine Shapiro. There are other books that you can read to help you prep for the EMDR basic training. In fact, at this point, EMDRIA has built in for each of the basic trainings, they're supposed to have a learning management system. For EMDR consulting, we use MyQuest. Other companies use other systems, but there's supposed to be these systems in place so that when clinicians come in, they are already coming in with some basic understanding. So there's some modules that you'll be working through even before you come to the basic training. So you at least have some groundwork done already before you come into the training. Number two, I would say as you come to the training with an open mind, an open heart, an open mind. And what I mean by that is some people come to the training and they are hardcore CBT, DBT, ERP, things like that, or other areas. I'm just bringing those up. But they're trained in other forms of therapy and brain spotting and other things, which all these things are great. Don't get me wrong, they're all great. But if you come to the training and your mindset is, this is the only thing that can be used to treat trauma or that can be used to treat OCD or whatever else is going on in the client's life. If you come in with that mindset, you are going to probably struggle in the EMDR training because EMDR, again, this is a lot different than other forms of therapy. Some of the things that you might be doing in that form of therapy might be different from what we're doing in EMDR, or the way you're treating the client is going to look quite different. And so if you come in and you're not open to it and you want to challenge the trainer and you're not open to doing practicum experience and you just want to stay in your little box and this is all that will ever work, this might not be the best training for you. You might want to reevaluate that, and consider, is this the best use of time and space for you? Because if you're going to come to this training, you're coming in, and you're going to learn something new. So be open to it. It might be that you do this training and you still use what you've been using, but you're adding tools to your toolbox. And that's really what it's all about. If we're talking about being trauma informed, and I think that's the goal, a trauma informed therapist, you understand that one size does not fit all. So if I only did EMDR and I never did anything else, I'm not going to be able to reach as many people as I would if I was to integrate other forms of therapy that might be more appropriate for them, and they're presenting issues or whatever they're going through, right? It's all about integration. And so it's not about competition here. It's about integration and doing what's best for our clients. All right. The other thing I would say is if you come in, when you keep in mind that when you come to EMDR basic training, you might have a lot of skills. You've been in the field for a while. You know what you're doing, right? But when you come to an EMDR training, this is new. This is brand new for you. You might have done your research and all that, but when you come in, you're not going to do it perfect. You're not going to know it all. And so you have to be open to that process, open to exploring. If you have a sense of you're responsible for everything or all these different things, or I'm not good enough, the training can bring all those things up because you're going to be reading scripts, you're going to be working through things, you're going to be approaching clients in a different way that you might be used to. And this is going to be some retraining, some trying out some different things. So again, you want to come in with an open heart, open mind, be open to the process, ask some questions, not defensive, but just, hey, I'm wondering about this. We love questions. We love to get those questions. but just be open to it. And sometimes if you kind of wait on it, the answer is going to come. It'll make sense as you go throughout the training. So again, I would say as you come into this experience as just as a new opportunity. I'm here to learn something new. I'm open to this. I want to try this. I'm ready for this experience. And even if you're someone who is more on the apprehensive side, I'm always looking for the doubting Thomases. And I certainly was. When I came to my training, I was a little worried. This seems a little scammy. What are you talking about? Waving your finger. I don't know about this, but my best friend had told me it does work. And she believes a lot of things are scammy. And she said, this actually works. I was training. So I was like, okay, I'll give it a shot. And I will say from the training, I walked away with a new experience and it was great. But if you come to the training and you're dead set on this isn't going to work, I don't want to do this. My job is making me come. I don't like this. I hate this. Then you might get a confirmation that that's true. But if you come in with the mindset, I don't understand everything. I have questions I would like answered. We'll try to answer those questions. But you know what? I'm going to give it a shot. I don't know if this is going to work, but I'm going to give it a shot. If you come in like that, you're going to get a lot more out of this experience. And it might be, for me, it was life changing. It ended up changing my whole career path. I ended up now I am an approved EMDR consultant, a trainer in training for EMDR consulting. I do consultation calls 6 days a week. And so I'm training other clinicians in this awesome form of therapy. That is not at all where I started at. Like I said in the beginning, I was like, this don't make a lot of sense to me. I don't quite understand everything. And so I think that the other thing I would say is some of this is not, we can't explain every single thing about it. We can show you research, we can tell you what the reasons we think that it works, but everything is not always crystal clear across the board. So keep that in mind, okay, as you come into the training. So again, come in prepared, be ready for this new experience, be open to having your thought systems challenged as far as what you think can work. The big thing is you might have been trained that talk therapy is the way to help people. And I'm not saying it's not, but there are other ways that you can help treat clients. And some of them might work faster in some instances. Just be open to that, okay? So keep those things in mind. Hope to see you on the training soon. Bye-bye.